Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hello, Chicago. It's me again, Dr. Simbo Ige, the Commissioner for the Chicago Department of Public Health. I'm very excited to be here again for another episode of Healthy Chicago podcast. And today, again, another exciting opportunity to have conversations with the good people behind the work at CDPH. And today I have here with me Dr. Jenny Wah. Dr. Wah, please tell us a little about you, what brings you to this work, and what makes you really excited this post-summer conversation that we're having.
Hi, everybody. I'm Jenny Hua. I'm the Medical Director for Behavioral Health at Chicago Department of Public Health. I've only been in the department for about 9 months, so not yet at my year anniversary, but I'm so glad I'm here. There's just so much exciting work happening in public health right now, and particularly around what we're here to talk about today, which is substance use, preventing overdoses largely driven by opioids, fentanyl. It's in the headlines. But we really have an exciting opportunity to do something bold about it. And that's what we did over the summer.
Yes, indeed. And thank you again and welcome. So we have stories to tell. You know, I love to tell stories. And this is a very interesting story. In public health, we're always taking on complex problems. Our problems are always multifactorial, multi-causational. There are many different complexities. And today we'll be talking about something that's a really complex issue, but we have learned so much this year, and we have such a fascinating, conversation about the opioid overdose. So let's start with a little bit of context. This year we have, and over the last few years, we've seen an interesting trend in opioid overdoses. Dr. Wah, can you tell us a little bit about some of the numbers and the things that you saw that just, red flag in your mind that prompted the work that we've been doing in the last couple of months?
Yeah. Well, so the way that I think about the numbers is that there's the climate, and then there's like your weather patterns that changes from day to day, right? So the climate that we're in is that we're at a historic high in the number of deaths due to opioid overdoses nationwide, right? So, and in Chicago, focusing on Chicago, even in 2019, which is not ancient history, although it is before the pandemic, so maybe it is, you had over 800 people die from overdose in Chicago. By 2020, that number went up to over 1,300, right? Wow. So it's almost 1.5-fold, over 1.5-fold increase. And that hasn't really, in the grand scheme of things, changed, right? So we saw the sort of high water mark of the number of overdoses in Chicago was 2021. It peaked at 1,441. But then since then, we've seen a very slight, I want to say modest trajectory of decline, but still over 1,300 deaths every year, 1,300 Chicagoans that we lose to overdoses related to opioids. So, by the time I joined, by the time you joined, we looked at these numbers and we're like, this is unacceptable. We're seeing this decline, and we really want that to steepen, to kind of
accelerate.
Yeah, drop and accelerate. And also something that we see, and this is to the weather, that, we're looking at day to day how the number of overdoses fluctuate, right? We get data on the past 24 hours, whether there was a spike in overdoses. And looking at the weather patterns for the summer, right? In the summer, overdoses always tend to spike more in Chicago. So leading up to the summer, even this May, in the first part of that month, we had our first red spike alert of the year, which meant that the number of overdoses in a single 24-hour period was more than twice the average of the previous year, and that was over 50 overdoses on May 11th, Mother's Day.
Wow.
So that really, all of the conversations that we've been having about, what are we doing this summer to make sure that this trend doesn't explode again, really accelerated, and we gotta get boots on the ground, do something really quick.
Wow. And again, just to summarize, the national trend was a concern. The Chicago numbers, a bigger concern. And then the red spike alert over the summer just triggered something, and like, this is not acceptable. We have the responsibility of protecting Chicagoans, and we cannot, not on our watch preventable deaths continue. So I am always in the business of preventing the preventable. That's what I say. If it can be prevented, we have to try our best to prevent it. So what were some of the activities that we explored this summer to prevent the preventable? Those numbers have come down a little, and we're very excited to see the positive trend. But what did we do? What was it that, enabled this acceleration?
Well, we tried everything. So, things in public health, and, you're very well aware of this, obviously, work at different time scales, right? So some things you might start doesn't take effect, doesn't come to fruition until maybe like decades later. So over the summer, we had a very short time scale to work with. So what can we do at that moment, right? A lot of it was putting out communications when we had the red alert, calling in the CDC to help us investigate what drove so many overdoses basically overnight.
Right.
And it was also concentrated in the sort of historic epicenter of the overdose epidemic in Chicago on the west side. In these 5 west side communities was really what was driving that spike on May 11th. And so from that, we work with a lot of partners that we had already been working with who are doing drug checking at the community level, brought in the CDC to really accelerate that and get boots on the ground to all these hospitals that saw a lot of these overdoses, and also test the drugs that we collected, and found that there was indeed a new substance found with these drugs, which is an animal tranquilizer called medetomidine, that likely drove that. And then we continued, right? We didn't stop checking drugs. We continue to look at what the drug supply contains and share those results with our key partners. The other really important campaign that we rolled out is Operation SOS. Basically, this is something that Philadelphia tried, and to great success on their end. So we listened to our community partners who are like, we want to do this in Chicago too. Basically, you had trusted messengers from the community go door to door in some of the hot spots that we see, neighborhoods that are heavily impacted by overdoses. And we'll just give out Narcan door to door, right? Everybody should have Narcan. Destigmatize this, right? Okay. There's a lot of stigma surrounding drug use. Understand that many people, if not most people, have loved ones who are impacted on one form or another. Hand out Narcan, hand out resources, destigmatize, and really try to drive change at the individual community member level, and hopefully aggregate this grassroots, boots on the ground awareness and action campaign. And we did so many other things, including trying to get people more aware of different treatment options, particularly the most evidence-based ones. Understand that medication really have a central role to play. I mean, we don't like to pop pills, right? And there's a bit of a learning gap about like, okay, well, so I'm already addicted to something. You're telling me I need to take another drug to shift over my addiction. Well, and so there's a lot of, cultural change that both providers and people who use drugs may need to sort of grapple with to understand the role of medication, and so on and so forth. And we couldn't have done this without our state, county, intergovernment partners. That stuff may not be the sexy stuff, but, we really need all of these partners to kind of be on the same page with us. I'm really grateful for all of their support. And of course, the people who are doing this work and the communities, organizations that I can kind of just call and be like, hey, what are you guys saying? And yeah, I mean, it's a lot of sort of improvisation too within sort of the larger scheme of everything.
Well, Dr. Y, I was there seeing it unfold real time, and so I just want to appreciate your leadership and your persistence and in just figuring things out. When we say that public health is a team sport, but when I started, I said we're telling a story that started with there is something bad happening, and there is something that we see every summer that we want to solve for, and it is complex. There's so many different dimensions to it, and so it required an all of community approach. Every time we've seen things move in public health in the positive direction, it requires collaboration with everybody. We were putting out information. It required boots on the ground, people going from door to door, helping people to understand the solutions, how to use Narcan, and every home having Narcan. It required collaboration with the healthcare providers and saying, what can we do better to support our community? It requires community-based organizations, faith-based organizations, our aldermanic offices, so many different people coming together and say, we all have to help solve this problem. And so that's what I saw this summer, a coordination, a collaboration, a coalition of efforts across the city in a way that is just impressive. I mean, some of those meetings, we had maybe 80 more people in those meetings. Like, we have to solve this problem together. And for me, that's the story. This is really exciting. All the partners, state, county, partners, all in the room trying to figure this thing out. And then what did we see, Dr. Wa? After all of these different efforts, can we get medication? Can we get Narcan? Can we get information? Can we get, partnership? All of those things came together nicely. And then what did you see that is promising as a result of all of this effort over the summer?
Yeah. I mean, so first of all, I always, we cannot do enough of highlighting just the mobilization that I think drives public health efforts and change and health outcomes at the end of the day, right? Is that everyone gets involved. At the end of the day, right, substance use involves the community coalescing, coming together to change those root causes. Right. So I still want to highlight that that's the most important lesson we learned, right? Operation SOS went out and within less than a month knocked on hundreds of doors, spoke to over 1,000 people, right? So, there are these important sort of encounters that we're just building and they're sort of like maybe drops in the bucket for the time being, but I think over time they'll build to something much larger. Right. I mean, top line overdoses are down, right? We don't exactly know why, but we want to say that our efforts certainly contributed to this change in the right direction. Right. Overdoses are down quite a bit, right? And this is a national trend. But in Chicago, I do want to highlight that, we did come upon that modest downward trajectory starting in 2022 when fatalities and EMS responses, which is sort of like our signal for how many fatal and non-fatal overdoses are coming in on a day-to-day basis. Both these figures started declining, and then over the summer, actually citywide we're down even more compared to last summer, right? So we've really flattened the curve for the city, where usually you sort of see this little mountain peak at the middle of the year. We've seen that peak kind of shave off this year. So that's something that's really heartening.
Yes, we like to flatten the curve, and the curve is flattening. So I am very excited about that, and also that we were able to detect this new substance in the drug supply. I think part of this story is the greater awareness about the contamination in our drug supply, that many people who feel I'm ingesting some kind of drug or using some kind of drug, it's something else really, and people are not always aware. So that increased awareness of be careful what you're putting in your body, because it may not be what you think you are using is a component of that. So tell us a little about this animal tranquilizer that we found. Are we continuing to see that? Where does that stand? Yeah.
Right. So medetomidine, it's a mouthful. This animal tranquilizer, I mean, if you maybe paid a little bit of attention, you might have heard of xylazine. So medetomidine is an animal tranquilizer even more potent than xylazine. Wow. And when it gets mixed into the illegal opioid supply, what it ends up doing is even if you give Narcan to someone, which reverses the effect of an opioid for that person, right? So their respiration might be restored. They might breathe a little bit easier and come back from an overdose. You don't see them wake up because you also have this animal sedative mixed in their drug, and that's keeping them kind of not conscious, right, oftentimes. And then in addition, what we saw in a lot of patients who overdosed on a mixture of opioids and medetomidine is that their heart rate was really low. Right. And that can be, an added layer of danger, right? Because if your heart isn't beating fast enough, you're, in addition to not breathing because of the opioids, you're also not sending blood to your body. And so a lot of these patients had to receive additional medication to make their heart rate come back up. Some of them had longer hospital stays as a result. Are we seeing this? So the short answer is we're not seeing it continue to cause this level of trouble in our communities in Chicago. But we, as a city and as a country, are frankly not testing enough drugs at the community level to be able to rapidly tell people what's in your drug supply, right? So just because we're not seeing it have that level of impact doesn't mean it's not out there. So for example, I'll just give one example of why we think it's still a source of danger is that in Marion County in Indiana, they have a syringe testing program, and they've continued to see maybe I think about a quarter of their syringes test positive for medetomidine. So it's certainly out there. It's in the Midwest, right? Maybe not at the level we saw in May, but certainly something to be on the lookout for.
Right. So just, an encouragement to everyone out there. Our job, again, is to prevent the preventable. And one way to prevent the preventable is to be sure what is in your drug supply. So we are doing our bit, to continue testing at the community level so that we can detect what's in there. Anytime we see something strange or we see a spike in our numbers, we go and dig and investigate until we find out what it is. And it's our responsibility to let you know that we are seeing weird things in the drug supply. So we just want folks to be careful. You may think it's heroin, but it's not quite. You may think it's dope, but it's not quite. There are all kinds of contaminants in things nowadays that is driving the overdose epidemic. So we just want folks to be aware, and we promise to always keep you informed about anything that can be a threat to your health. Now, Dr. Wa, there are other things that as we move from summer, we're very excited to see this accelerated decline in our numbers of overdoses. But we know that substance use disorder is a disorder. The fact that you've overdosed once before and it was reversed doesn't mean you cannot overdose again. So as we head out of summer, we know that summer we see a peak in cases because people are out and partying and congregating and using, drugs together. And as we head out of summer into the rest of the year, how do we sustain this gain? How do we ensure that those who are at a higher risk of overdosing have the necessary support that they need to be able to recover and get the help that they need? Any plans there?
Well, so I think the way I think about the continuum of recovery and of harm reduction, right? So first of all, harm reduction and recovery go hand in hand. One cannot sort of work without the other, right? So I do think that, at every stage of recovery, there are roles for harm reduction. But at the same time, things like medications for opioid use disorder have a critical role in harm reduction too, right? People, when they're on medication like buprenorphine, which is an opioid, but does not work in the brain in the same way as your full potency opioids, and that it's really, really very tricky to overdose on buprenorphine. These medications protect people from overdosing even if they continue to use, right? So my philosophy is one that does not, see substance use as something that needs to be criminalized or needs to be punished or even as a moral flaw, right? I really, in my mind, dissociate quite heavily substance use and all of the sort of stigma surrounding it. But that doesn't mean I don't think that there is a role for medication, right? And that the disorderly consequences of substance use that make it difficult for a person to do the other things that might make their lives happier and flourish, right? Like being a member of the community and, being able to retain stable housing, et cetera, et cetera. So, I do think for all those reasons, there is an important role for making sure more people understand that medications for opioid use disorder, buprenorphine and methadone in particular, might be an option for them, right? And then that all the things that they might have heard and experienced around these medications, which, you know, we as a country has historically made incredibly difficult to get, and also did not sort of pair understanding how these medications ought to be dosed and used, and like the education around it very well, along with like just getting them into people's hands, right? So, you know, there are myriad of issues that we're trying to sort out to make both our healthcare system and the wider culture surrounding substance use sort of more friendly to making sure that people have medications as an option when they choose so.
Right.
So, you know, that involves talking to a lot of hospitals, a lot of emergency medicine departments, you know, a lot of people who overdose kind of go in and then quickly go back out again. And in the interim may not have really had an opportunity to discuss treatment options. We want to change that. We want to make sure that when you overdose, we want to make it as easy as possible for you to choose to take a medication that could protect you from a second overdose event.
Right. Thank you so much. You know, this is a complex issue. There are many different solutions that are necessary to complement and work together. But in my mind, I see substance use disorder as a chronic illness. You know, when we say substance use disorder, we're saying that the compulsion to keep using even in the face of adverse consequences. And that's how we know that it is a disorder, because if it was simply left to the individual to make a will and say, oh, I'm not going to do this anymore because it's impacting my health, it will have been easy. But it is a disorder that alters your ability to say no, even in the face of negative consequences. So what do we do in that situation where the individual cannot just say no? That compulsion makes it challenging to do that. What we are offering is options to those individuals, and how do we destigmatize substance use disorder so that people are offered options, treatment options, including medication as a treatment option when they overdose. So one of the progress that I've seen here in this space is just the destigmatization, that we could have this all of community response where everybody says, you know, I'll help, I'll do something. So that for me is a welcome shift in prioritizing. Everybody is deserving of help. Everybody is deserving of support. Now we want to add the additional layer of, yes, we want to reverse the overdose. We don't want people to die. But we also want people to become productive members of the community and have that opportunity to recover by connecting them to treatment if necessary. So, Dr. Watt, tell us a little about, you know, the treatment options. I know we have a telemedicine option where people can just call a number and get connected to treatment. So if you have a loved one, for instance, who has a substance use disorder, can you access that medication? Can you connect them to services? How does it work?
Yeah, so together with our partners in the Illinois Department of Human Services, IDHS, we fund 24/7, I want to emphasize, helpline called MAR Now, MAR Now. It's really, you know, as easy as it gets. You call the number, which you can find if you Google MAR Now. I don't have the number.
Right. MAR.
MAR Now, NOW. So it'll pop up, and there's the number that you can call. Someone will answer your phone call, and you will get connected in real time right away to somebody who can prescribe medications for opioid use disorder. The service provider will set you up with transportation, with appointments to go in person if necessary, or it's telemedicine, so you can get the prescription without even going into the clinic to see anybody, and you can pick it up at your local pharmacy, take the medication at home. Have instructions throughout the whole process kind of telling you how this will work. It's a great service. Over the summer, we marketed it, particularly in our hot spots, and saw an uptick in the number of phone calls coming in over the summer. So that's also something that we're really proud of.
Yes, thank you, Dr. War. Again, folks, remember, if you have a loved one, a friend, a colleague, anyone in your community that has a substance use disorder, remember it is a disorder. and they need an all of community support. One, there are medication available to reverse an overdose. That's Narcan. Narcan is available all over the city. Every public library has it. We have vending machines. You can just check our website and you will see that there. We also have treatment options available via telemedicine even. You don't need to go into a hospital. You don't need to go into a clinic. You can call the number and get connected to treatment if you so desire. We will continue to work at this. Our work is not done. We are very excited to see the progress this summer. A report will be out detailing all of the different aspects of this work. And we know that our work is not done. It's going to require all of us again. Chicagoans, we're a welcoming city. We have big shoulders. And so we continue to call on our partners to support us in getting the word out. That help is available. And again, we celebrate all of the heroes in the public health department who have taken it upon themselves to prevent the preventable. People are doing an amazing work supporting and protecting the health of Chicagoans. So thank you, Dr. Wa, for all you do. He was working nonstop over this summer at every event, at every gathering. We were there, Narcan saturation, thousands of Narcan nasal spray were distributed. So we will continue to do our very best to keep Chicago safe, healthy, and resilient. And thank you again for spending some time with us today on the Healthy Chicago podcast. And we will be back soon with another very exciting public health program.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.